This presentation is for Nursing Capstone Deliverable 5. A scenario that had a large impact on my current role as a nurse was about a year after I started my first nursing job. I was working at a nursing home facility. I had a patient with terminal skin cancer with an open wound on her forehead that was open down through the bone. The doctor predicted that eventually she would become septic and pass away. At the time, she was thriving and was for the most part independent. One morning, on the weekend shift, I was called into the resident's room by a nurse's aide. The aide reported that she had tried to wake the resident for breakfast, but that resident wouldn't respond. This resident was lying on her side in the fetal position, facing the wall. I tried to roll her towards me and talk with her. She wasn't responding appropriately, her words did not make sense, and she was pulling away from me and appeared confused and scared. There was a very large amount of foul, purulent drainage coming from this resident's forehead dressing. This resident had a fever and was exhibiting signs of sepsis. I called the family and updated them on this resident's condition and asked how they would like to proceed, as this resident did not wish to be hospitalized or treated with antibiotics. The family said that they would like to start hospice. I called and spoke with the provider, got a hospice referral, and comfort medications. I spoke with the family and discussed hospice services. I contacted the hospice company and collected all of the documentation needed to admit her to hospice. This is not something that floor nurses are trained to do, let alone one person. This is usually an interprofessional team effort. I managed to get everything together, and the hospice team came a few hours later to admit her. It was very important to the family that this resident was comfortable. This resident's care was managed by the facility and the hospice team, and she passed away comfortably 3 days later. This experience helped me grow as a nurse, as I had to get out of my comfort zone, step up as a leader, and make the proper arrangements for this resident on a weekend with no support from the management team. This scenario had a positive outcome for both the resident and the family, as the family was very happy with the care that the resident received from the facility and the hospice team, and the patient was able to pass away comfortably. I recognized the resident's condition was declining, and with her symptoms, terminal diagnosis, and wishes to not be hospitalized or treated with antibiotics, she would likely pass away soon. It was this resident's and family's wish for her to pass away comfortably. I recognized that I needed to get her on comfort meds and hospice, if possible. I am always looking for ways to improve the healthcare environment that I work in, to ensure better quality of care is delivered. For example, the current facility that I work in uses their patient census to determine their staffing ratio, instead of determining the staffing ratio based on the acuity of the patients that they have, to ensure proper care is being given and that there are enough staff to care for these patients. This has become an issue when it comes to the quality of healthcare that is being delivered. I brought this to the administrator's attention, along with research supporting the use of patient acuity for safe staffing ratios and the effect on the quality of healthcare delivery. The research shows that the higher nurse-to-patient ratio has a significant effect on nurse outcomes. A time that I challenged the status quo was when I confronted the administrator about mandatory overtime because of short staffing. Nurses were being forced to work 2 to 3 16-hour shifts a pay period. This was causing staff burnout, and nurses were quitting. I confronted the administrator about the issue and informed her that the state of Minnesota nurse overtime laws state that nurses cannot be mandated to work more than 12 hours unless in the case of an emergency. I had to explain to her that short staffing that management is aware of days and weeks in advance is not an emergency. That this would mean that this is the management team's responsibility to fill these shifts and not the floor staff's. A time that I had the courage to do the right thing in my nursing practice was about 6 months into my first nursing job. The facility I worked at got a new director of nursing, and she was making decisions that were questionable to the floor nurses. An example being she accepted a new admission that had a portacath with orders for medication to be infused through the portacath, which is something that this facility is not capable of having due to staff issues, because only registered nurses can perform this task, and this facility doesn't always staff a registered nurse on every shift. Another issue was that none of the registered nurses had any training on how to use a portacath. I was extremely uncomfortable with this situation, so I confronted the director of nursing about this, and she stated that she would use a YouTube video to train us. I told her no, and that I was not comfortable working with this patient, and that I would not accept any assignments on this unit until she had properly trained every registered nurse in the facility on how to use a portacath with proper form of education. I then reported this to the administrator, and this patient ended up being sent to a different nursing facility that had the means to properly care for him. A time when I integrated a collaborative approach to my nursing practice is when the facility I worked at was having issues with new hire nurses making multiple mistakes after they had completed their training. The facility would place a new hire nurse with any nurse that was working on any given day, and it didn't matter how long the training nurse had worked at the facility. So a new hire nurse could be getting trained in by a nurse that had only worked at the facility for a few months, instead of training with a nurse that had been working at the facility for a few years. So another nurse and myself approached the management team with the idea of creating a preceptor program with a specific group of nurses that would be training a new hire nurse. These nurses would be assigned a new hire nurse, and they would stay with that nurse until they completed their orientation, ensuring that they received competent, consistent training. This way, the management was sure that the new hire nurses were being trained correctly. This concept was put into place at the facility, and this facility has seen improvement with the competency of the new hire nurses. The knowledge that I have gained throughout this program has helped me grow as a nurse. My leadership and management skills have grown. I have learned more in depth about nursing research and theory. I have also improved my clinical judgment and professional nursing skills. I know that after I graduate, this will not be the last nursing education that I will complete. I will always continue learning, as the world of nursing is always changing and there is always new research to support new evidence-based practice. I will continue to take classes and research new topics because as a nurse we continue to learn throughout our career to provide the best quality of care for our patients.